Y'all know I love a good segment where I get to take my shoes off and put my slides on. So whether you're a weekend warrior or exercise every day, being active comes with risks. Our next guest wants to help you get ahead of a fall or an injury. Peak Physical Therapy is offering adults free injury prevention and fall risk screenings through October. Here to show and tell us about the new technology behind those screenings is Jay Estes and Amanda Strang of Peak Physical Therapy. Good morning, y'all.
Good morning, Erin.
Okay, so let's talk about this state-of-the-art equipment. Tell me about it.
Oh, thanks, Erin. Yes, and you said it right. It's a state-of-the-art equipment. It's cutting edge. It's a Sparta force plate from a company called Sparta Science that developed it originally for high-level athletes, for the military, to really be able to go in and tease out issues with strength, balance, power, things like that active folks need to prevent injury.
Okay, cool.
And then we realized pretty soon that it's great for physical therapy.
All right, well, show me how you do it. Show me what the screenings consist of. I want to see all the things.
All right, perfect. Okay, so we have you already loaded in here,
okay,
and we're just going to start the scan. It's going to tell us exactly what it wants you to do.
Okay.
But I'm going to have you come and stand right in the middle.
Okay.
Feet about hip width apart. Perfect.
Mm-hmm.
And it's going to weigh you. Don't worry.
Oh, God.
It will not say anything. Okay, and then it's going to tell you what it wants you to do.
Okay.
So you're going to shift your weight all the way to the right, trying to keep it in that green bar there. That's good.
Ooh, there we go.
Perfect. Okay, awesome.
I'm doing
like
it, y'all. I'm glad it didn't show my weight. I've gained since I've been here, y'all. Eating all the food on the show.
Perfect. Take a little break, and then it'll do the left side.
Okay.
Super quick, super easy.
Technology is really evolving,
And
isn't
clearly portable. Doesn't have to be plugged into anything.
Okay, so lean to the left.
Yep, good.
Perfect.
Look at me guarding you like you're gonna fall.
And I appreciate you.
All right, perfect. You did it.
Okay, so do I step off?
You can.
Okay. So.
Oh, it didn't like that.
It didn't like me? Oh, it said please remain on the plate.
Sorry.
Y'all, it don't like me, y'all. Okay?
You're gonna have to do the left side again.
Okay.
Sorry.
So while we do the left side, tell me, how can people sign up? Because you guys actually do free scans,
We
right?
sure do. Yeah, if they go to DallasMoveToLive.com, you can sign up at any of our 7 locations throughout the DFW area that are offering it. And they'll just go in there, they can pick what's closest, and we'll call them and we'll get them set up. It's super quick.
Yeah.
So it does show that you have, here, let me do it a little bit bigger.
What's my results, y'all?
It shows that you have a little bit of better stability on your right leg than your left leg.
Yeah.
So we would use this to know that we need to work on your core and your left hip strength.
Got
and
it.
We would then progress to one leg balance. We would do jumping, then we can see the power of how you're moving.
Oh, wow.
And then we could do planks to see how your upper body is stable.
Oh, God,
as well.
y'all don't want to see me do no plank, y'all. I don't work out at all. Okay, so I probably could use some core strength as well, honestly, because
I mean, who
who
couldn't?
Okay, great. Okay, so you said you guys use this for athletes, military, and so, but normal people can come too, who are just, they work out on their own and do all the healthy things not me, I don't do the healthy things, but they can come to you, right?
Everything from little kids to older adults. We're using it for my daughter's soccer team.
Yeah.
You can use it for anything. It's really, really flexible.
Nice. Okay, so tell me maybe why it's so important for people to maybe know this about themselves.
Sure. Well, September was Fall Prevention Month, and this is October is Physical Therapy Month.
Yes.
And so we are doing a bunch of screens for fall prevention. It's super important for people to understand where their weaknesses are, where they're at risk of falling, to make sure that they aren't at risk of injury. The falls are one of the highest risk in healthcare that cost the most money, that lead to the most problems. And so if we can find that source of deficit, then we can go in and address it. We can be real specific to that patient and how we address it and setting up their care plan.
Okay, so there's work after you get to stand on the plate,
And
right?
you can do it on
we
the
can
plate.
do it right here if you want to see. If you want to step on up there.
Yeah. While I do this, I'm going to tell them all about it so they know where to go and how to find you guys. Peak Physical Therapy has 24 Dallas-Fort Worth area locations. For more information on the 7 locations offering the free risk screenings through October 31st, go to DallasMoveToLive.com. Y'all, I'm going to figure out what's going on with my body before we go to break. Y'all want to see me jump before we go, though? How do I jump, y'all?
You might want to do it barefoot.
Okay, let me see. Let's do it.
You're going to do arms up overhead.
Uh-huh.
You're going to go down, up.
Ooh.
Oh, well, that's one way to do it. We would do it on here.
Oh, okay.
Floating on there.
Actually. There you go. Good.
That was a good jump, y'all. Did y'all see that at home? I hope so.